Hi there guys, welcome to another episode. Today we'll be giving you a bird's eye overview of medical training in the UK. In this episode we'll be covering three main things. The first is to give you an overview of the UK medical training pathway, just to give you an idea of the different hurdles you could face as part of your medical training journey. Secondly, give you an overview of the common points where there are competition bottlenecks in the UK medical training pathway, and of course we will explain what competition bottlenecks are. And then finally, to give you an overview of the application process for postgraduate training in the UK. So let's start by discussing the UK medical training pathway. At first glance, you may be a bit confused about what you're seeing on the screen. I agree with you, it does look a bit jumbled and a bit messy, but trust us on this. This is in fact a simplified version of the different hurdles you could face as part of your medical training journey. It all starts at medical school, where one of the big decisions you'll make quite early on is whether to integrate or not. Now, some medical schools, for example Imperial College London, integrate intercalation as part of your medical training, meaning your medical school becomes 6 years long instead of 5. But it's in fact during your final year where you'll make your first decision that affects your postgraduate medical training, and that is of course when you apply for the foundation program. Not only will this influence where you work in the UK, but also what clinical rotations you will have as a foundation doctor. Now, of course, this is influenced even more if you decide to embark upon the academic foundation program or the psychiatry foundation fellowship. Now, during the beginning 4 months of your foundation year 2 program, you will then be expected to apply to your chosen specialty interest. This is really where you branch off into your own medical journey. Training programs vary in length, but also entry requirements differ depending upon what specialty you decide to choose. For example, neurosurgery requires candidates to do an entrance exam called the multi-specialty recruitment assessment. However, what you'll see, and this is indicated by the green arrows, is that there is flexibility in training, and yes, you can switch between different specialties depending upon what your desires are. But regardless of what training pathway you do, they all lead towards consultancy, which is the final aim of training pathways in the UK. So what are competition bottlenecks? Well, this refers to points in your medical career journey where there will be competition amongst other candidates. Now, this may be with UK medics or even international medical graduates. And basically at the point of a competition bottleneck, there is a process to filter out candidates, and this often includes a review of a candidate's portfolio to determine their compatibility with the specialty that they're pursuing, and other elements, for example entrance exams and interview performance. So why is it important to know about competition bottlenecks, and frankly why should you even care? Well, let's go revisit the original diagram that I just showed you. Like I said, as part of your medical training journey there will be a lot of hurdles, but throughout your entire medical career journey there will be competition bottlenecks along the way. For example, even getting onto an intercalation program will be competitive. Getting onto a foundation program is competitive, even more so if you apply for the academic foundation program. And some specialties are known to be notoriously competitive, for example, neurosurgery. But the main emphasis that I want to display to you guys is that there is competition even to the point for applying for consultant jobs. So one of the main takeaway points from the last image is that medicine is extremely competitive. Not only is it competitive to get into, but even as a postgraduate, you will face multiple competition bottlenecks during your medical career journey. So let's actually put it into context. What you're seeing here is the top 5 competitive training programs as of 2019. At the top were community sexual and reproductive health, with a competition ratio of 11.6. That means for every post, there were 12 applicants applying for the same training number, indicating that just having a medical degree is not enough to get into the career that you want to pursue. So now that we have an appreciation of the medical training journey and the multiple competition bottlenecks that you may face, now let's talk about how long it will take before you become a consultant in the UK and hopefully make the big bucks. Now, to better understand how long it will take before you become a consultant, let's revisit our original image. So of course medical school takes between 5 to 6 years. Often it becomes 6 years when you have an integrated degree as part of your medical training. Then of course your foundation program will take 2 years. Now, regardless of what type of foundation program you do, for example the academic foundation program, all foundation programs are 2 years in the UK. Then of course your training program length really does differ depending upon what subspecialty you decide to do. So for example, internal medicine training and core surgical training are between 2 to 3 years before you then undertake specialist training that can take between 4 to 5 years. On the other hand, if you enter a run-through program, for example, general practice, GP, this will only take 3 years, which you apply directly in F2. But of course, all roads in training lead to consultant posts. So you may be asking, so how long then? Let's presume you do a 5-year medical degree, and on every attempt for your postgraduate medical training, you get in on the first time. Well, if you apply to GP, you will undertake the shortest medical training pathway in the UK, and that is a total of 10 years. 5 years medical school, 2 years foundation program, and 3 years general practice training. However, on the flip side, the longest training programs often take 15 years, and these can be both surgical and medical related specialties. And that's what we mean when we say medicine is a lifelong program, because this is a big commitment, 10 years versus 15 years. So you have to be very conscious of the reasons why you're choosing a medical training path, knowing full well that different medical specialties have different training length. So now that we have an appreciation of both the route into training and also the time it will take for you to complete training, let's now discuss how you will apply. And the key platform that you will use is something known as Oriel. And this is just a screenshot of the login screen. Now, Oriel is a centralized hub where you will apply for postgraduate medical training programs in the UK. Now, this includes applying for the different foundation programs, but also the different specialty programs that you may want to pursue. But also it is used by other healthcare professionals, such as dentists and pharmacists for their own training programs. So what will happen is, in your medical school, when it comes to your final year, you will use Oriel to apply for your desired foundation program. And as part of your foundation training, when it comes to your specialty application period, once again, you will use Oriel to apply to your preferred specialty training program. So that concludes this episode. Often we find that medics don't really appreciate the postgraduate medical training journey and the hurdles that come with it. But by knowing this, we feel you can start to make informed decisions about which career you want to pursue, especially once you realize the variation in training times depending upon the specialty. So if you found this video useful, feel free to share our course with your colleagues and follow us on our different social media platforms for additional career info. And if you have any questions, feel free to get in touch via the email shown.